Yeah, some breaking news now. Texas leaders say they want more control when it comes to enforcing rules for wearing masks. Houston Mayor Sylvester Turner, as well as mayors from Austin, San Antonio, and other Texas cities, just sent a letter to Governor Greg Abbott. They're asking for the authority to set their own city rules and regulations for face coverings. The letter says, in part, we should trust local officials to make informed choices about health policy. And if mayors are given the opportunity to require face coverings, we believe our cities will be ready to help reduce the spread of this disease. You can read the full letter right now on KHOU.com. And today, the governor says the state hit a new high for the number of COVID-19 cases reported today. It comes after several days of record hospitalizations. Adam Bennett has more on why the governor says there's no reason to be alarmed.
It's a new daily high for Texas, 2,622 cases, and one that Governor Greg Abbott says needs context. He said today some test batches are returned in bulk. Some, like Pecos County, have errors, and prisons yield the highest numbers. Governor Abbott said fewer than 10% of Texans testing positive for COVID-19 need to be hospitalized. That includes just under 800 patients in the Houston area. About 21% of our region's hospital beds are available, while just under 10% of its ICU beds are open. Governor Abbott said Texas is still at its lowest threat level for hospital capacity.
We are now in a situation where we are coexisting with COVID-19, where we do not have to choose between either returning to jobs or protecting health care. We do have the tools and the strategies in place where we can achieve both of those ends.
Governor Abbott said he spoke with hospital CEOs from around the state on a call this morning. He said they expressed confidence they could keep making beds available. The governor also said those hospitals could limit elective procedures to free up more space in the future, but he and other officials still urge Texans to do their part to limit the spread of the virus. Adam Bennett, KHOU 11 News.
And then you have doctors and leaders in the Houston area not as confident as the governor. In Harris County, the uptick in cases continues and more patients are being admitted to the hospital. Our local leaders are concerned that it's taking a toll on our hospitals, says Ron Trevino, who's talking with the Harris County Health Authority.
Dr. David Pearce says this uptick in hospitalizations has him anxious. He says right now in the Houston area we have plenty of hospital beds and ICU room, but he is clearly concerned about what he calls the steep slope upward in cases. Right now, Dr. Pearce says we are at 45% bed capacity in local hospitals, not a number that disturbs him. He says overall we've got room, but the problem is individual hospitals are being overwhelmed to the point of telling ambulances to go somewhere else. He said that happened to 4 Houston area hospitals Monday morning.
It's starting to feel a little bit like flu season, with hospitals requesting that ambulances go elsewhere because they're full. Not uncommon November through February, but in June, very uncommon this time of year.
He says part of the issue is hospitals are trying to catch up on elective surgeries that have returned and deal with COVID patients. Coming up at 6 o'clock, more on what Dr. Pearce has to say about hospitalizations here, plus a trend he's been noticing, younger people coming down with the virus. Back to you.